Thank you for joining us for the Oxford Internet Institute's Wednesday webinar. There's an app for that, Tech Governance during COVID-19. A little housekeeping. We are fortunate to have a varied audience with a wide range of views, and we request the opinions of others are respected in this space. For your awareness, this event is being recorded and will be posted on our website at a later date. Pose any questions using the Q&A tab at any time. These will be answered at the end of the talk, and please keep questions as concise as possible. These will be visible to all attendees, and we will endeavour to follow up any unanswered queries. Please allow me to introduce today's moderator, Dr. Aaron Martin.
Thank you very much. Good afternoon, everyone. Good evening, good morning. Thank you for joining us today for the webinar, which is kindly hosted by the Oxford Internet Institute. I'm Aaron Martin. I'm a postdoc at the Tilburg Institute for Law, Technology, and Society in the Netherlands, where I work on the Global Data Justice Project, which is graciously funded by the European Research Council and led by my colleague, Dr. Linnet Taylor. Today, I'm joined by three esteemed experts who are rectangularized here with me on your screen. Please allow me to introduce them. Dr. Seda Gursis is an associate professor at TU Delft in the Netherlands and works on privacy engineering and the political economy of computational infrastructures as they cross questions of social justice. She's also a member of the DP3T project, which developed a decentralized proximity tracing protocol, as well as a member of the Institute for Technology in the Public Interest. Dr. Michael Veal is a lecturer in digital rights and regulation at the University College London's Faculty of Laws, and one of the co-authors of DP3T. And finally, Nikita Argowal is a research associate at the Oxford Internet Institute Digital Ethics Lab and a doctoral candidate at the Oxford Faculty of Law. Her research examines the regulation of artificial intelligence and machine learning-driven decision-making with a focus on applications in consumer finance. She's a lawyer and previously practiced at the IMF and Clifford Chance. Unfortunately, due to unforeseen circumstances, Corinne Kath is unable to join us today. Just make sure my panelists are now visible to everyone. Before we start the discussion though, I'd like to provide some context. Earlier this year, as we were all entering the first lockdown, it dawned on my colleagues and I on the Global Data Justice Project that pretty much every country was undergoing intensive socio-technical change spurred by the response to the pandemic. We wanted to capture as much of this as possible across as many contexts as possible, and to understand what it all might mean for both governance and justice. We realized that to do so, we need to leverage the extensive global networks of critical scholars and activists doing great work in this space. The outcome of that effort is an edited collection spanning 38 chapters. The book was published by MeatSpace Press in August of this year. The collection is openly accessible on meatspacepress.com. You can also purchase a copy with the promotion code visible on the slide that I'm about to share. So just bear with me one moment. There we are. So before we kick off, I again want to encourage you all to ask questions of our speakers using the Q&A box, and I will check on that box in a few minutes after we run through a couple rounds of questions. So the first question is for you, Michael. Since you contributed to the book, I'll ask if you could reflect on relevant developments in your area of research since the collection was published in August. In your contribution to the book, you explore the sovereignty implications of the global rush to develop digital contact tracing apps during the initial phase of the pandemic. Could you summarize your findings and perhaps reflect on what's transpired in this space since then? Thanks.
Yeah, sure. Thank you, Aaron. So in the book, myself, but also Seda Gursis is also on the call here, were involved in the creation of one approach to proximity tracing using mobile phones and their Bluetooth capability. And that was an approach which we designed to be basically maximally controlling and limiting of power and abuse through privacy enhancing technologies, as well as other considered approaches in the design. And it was ultimately a protocol. The interesting reason why this protocol is adopted probably as widely as it would be, and it is around the world, is because the platforms that control smartphone ecosystems, particularly Apple and Google, effectively put their money and infrastructure behind the type of solution that we proposed, as opposed to the solution that some states were proposing and some other actors. So it was a bit divided, but it became quite clear to governments that, which we'd known for a long time, but I think it hadn't been quite as obvious before to some, that whenever they were making an app, they were really engaging in a public-private partnership, and that the extent to which they thought that individuals who had these sensors and actuators in their pockets could be switched on and turned into sensors for the environment effectively, was mediated by technology platforms who were not afraid to wade into very high-level geopolitics and are not effectively afraid of legislative backfiring in kind of the countries that were involved. Notably, even the few countries which were very hell-bent on having a centralized system, which I still don't really believe is there's been much evidence to show that is particularly effective in a different way. Even those countries had not prepared legislative instruments or did not use the normal powers that states had in order to effectively force phones to operate in the way that they wanted. So that was an interesting example of the willingness of countries to engage in that. And there are, of course, legal barriers. I think, as I'm sure Nikita is aware, particularly as a lawyer on this call, where based on things like European law, you can't just go and regulate platforms as a single member state, because there are limits to the ability in which you can control goods and services within the European Union. So we've seen that as a flashpoint, and I think it will stay with us now as a visible example of a time in which platforms constrained the willingness of states. Now, how will that affect what we see going forwards? We still see discussions about breaking and recoding end-to-end encryption, for example, in Australia, and by design regulation in the United Kingdom and elsewhere with the Online Harms Bill and similar bills. And we're looking to see what will happen in the EU with the Digital Services Act. We see a greater willingness to use legislative instruments to impact the design of systems. But interestingly, what we perhaps don't see is the capacity to have a normative vision for what how platforms operate and how the internet and its associated technologies should work politically. So we see willingness to, countries want to be able to change something, but it's in a very ad hoc, reactive way still. And they aren't putting the resource, or indeed, I think, the political vision behind what a platform ecosystem which maybe did have more democratic control, or was more evenly, the power was more evenly spread across the world, what that would look like. So I think that's the interesting gap that we still see today. And the last thing I want to just say on that point is that that's a real limiting factor for governance, because where we find ourselves today with platform ecosystems entirely is that they have cornered sovereign states in many different ways, from sides of privacy, from sides of power, from sides of competition. And if you tackle only one of these issues at a time, if you say, oh, we're going to damage the ad tech ecosystem, or we're going to break these companies apart, they can pivot and slither into another form. It's only with a concerted effort in multiple areas of, I'm talking about legislation here, but we've obviously got other tools of governance too, but only by doing many things at once in a concerted way do you cut off those Hydra heads. And there's no willingness, appetite, or capacity to do that in the public sector, in Europe at least. And I think we've seen that now.
Thank you, Michael. Now, Seda, our next question was submitted by a member of the audience in advance of today's discussion. What notable trends or divergences across contexts and cultures have you observed with respect to the use of data and technology in the pandemic response?
I'm going to answer the question, but first I need to do something. All right. So this is the book, right? You need to show it. There you go. Hello.
Thank you, Seda. I actually don't have a copy of the book anymore. I gave away my last one.
Oh, that's sweet. Okay. Well, I mean, that's very generous of you, but we now have copies, and I partially have it because my partner also got it. But I just wanted to say we were all like super information overwhelmed and in crisis mode, and also trying to convince the world that this was not a temporary condition and things were kind of, catapulted forwards and we should be watching. So we were all, I think, in over alert mode. The fact that you could pull a book together in that moment is like super amazing. And congratulations to all of you, and especially the editors for putting it together and also pulling us together today to celebrate that. So first of all, thank you on that one. And then the second thing I want to say, which will lead to my answer, is the way that Michael was doing something that I've recently been doing, which is like, you know, shaking his phone towards the screen, trying to make a point, right? Like, and what is this point that we're making? You know, I'll stop doing it now, even though like I've like so many times on Zoom calls kind of like reached down over my table and pulled my phone and shaken it at people, and they're probably thinking, why is she doing this? Okay, so to answer the question, what are context and cultural differences or contextual differences? I'm going to answer the question in the reverse. I'm going to talk about what was common, right? In kind of what happened. And in order to do that, we need to get to the shaky business, which is that we now have computational infrastructures that are already laid out and they have massive logistical power, right? And they can move information, and if need be, they can move things, right? Like with Amazon and Uber, we know they can also move things. So what do I mean by these computational infrastructures? So I refer to very, very material things that are expensive and that maybe only came to being because, you know, there were all these like investment bubbles, especially the crisis, the financial crisis of 2008, and immense inequality in the world, right? Like, so remaking this computational infrastructure may not be something we really want. But let me tell you, what is this computational infrastructure? So shaky, Google and Apple, most of the phones, apparently 99%, Amazon, Microsoft, Google, and a few others that run the clouds, and a host of other companies that are in the process of rolling out sensing infrastructures to our lived and used environment. So, you know, we can maybe refer to this as edge computing or 5G, but it's basically putting sensors and computational possibilities into cities, transportation, farmlands, our homes, and delivering to us, you know, what IBM has coined in the 90s as smartness. So what does that mean? Why am I talking about all this? So computational infrastructures, they come with methodological propositions, right? Like, how do you do things? You can put things on their infrastructure and they'll do things, and they don't have immense variety in how you can do things. They have kind of their own logic. And if I would summarize in a very blunt way, it's turning social problems into engineered ones. Okay, so that's kind of what we did with contact tracing app. We took a social public service complex, right? It's about care, it's about infrastructure, it's about logistics, it's about looking people in the eye and seeing how they're doing, and we turned it into an engineering problem. This means that by using this computational infrastructure, which the governments did, when they said, we want apps, they literally summoned this computational infrastructure. What they're doing is understanding that they can now turn social problems and public services to things that can be engineered, which means they can be controlled from a central point of view and optimized, okay? And it's very interesting to see how across the board, governments were excited about using computational infrastructures for population control, and something that they did in their own ways with police and all sorts of executive mechanisms, but now they could do it using technology. So they were excited about this, and they thought they were getting something really big out of it, right? When in fact, they were giving a lot away. Right? And I think this is what Michael is also trying to get at a little bit in his comments. So what do they get? So they sniffed how they can manage public institutional resources and operations using optimization as a technique. And they entered the domain of population control, right? Population control management optimization. And these practices are mastered not by government, but by tech companies. They have their own methods of doing this. And they do this through the devices in our pockets and often also in front of our faces. They're not just in our pockets. And they practically in the process opened like wide open health authorities and citizens to the management techniques embedded in these infrastructures. And so I think this was common across the globe. And I can talk about, for example, Turkey. The other thing that was common, I think, is the disregard for mutual aid projects by governments, right? Like there has been immense amounts of community organizing and mutual aid that I did not see any government systematically pick up. Facebook picked it up, a bunch of social media picked it up. They had all sorts of like ways for communities to organize. The governments did not pick it up. They did not see it as an opportunity to connect with their people. And in fact, at some point, we had the feeling in Belgium that they were like, oh, let's not do stuff because it seems the community organizers are going to take care of it. So I think these were like the two common things that we see: an excitement for population management through computational infrastructures, and a kind of disregard for mutual aid and bottom-up organizing during COVID. Sorry, that was a long-winded answer, but thank you.
That's great. Thank you so much, Seda. Now, Nikita, I'll turn to you. We've seen a lot of buzz this week about some research that's been published in Nature. The title is Mobility Network Models of COVID-19, Explain Inequities and Inform Reopening. So the research suggests that disadvantaged racial and socioeconomic groups suffer from higher COVID-19 infection rates solely from differences in mobility. So what, in your opinion, what should we take away from their findings, and how can this be used to inform policy responses in the coming months?
Sure. I should say, first of all, congratulations on this very impressive book, which you've put together at warp speed. And maybe this is like the Operation Warp Speed that actually happened and actually worked. But okay, so this is a really interesting piece of research out of like a coalition of researchers in the States. I think there were two mechanisms that they highlighted. One was mobility, so groups that were not able to reduce mobility as much in a lockdown had a higher risk of infection. And secondly, the second mechanism is where they were going, right? So the places of interest, and they identified that these groups are also more likely to visit establishments that were more dense in terms of people inside, and they were more likely to spend more time in them, so their exposure was increased. And I think it's important to remember that the people in the study all started off with the same risk of infection. So it's not attributable to underlying or pre-existing conditions. It's entirely due to these mechanisms that they identify. And this is really interesting because I think it kind of serves to remind us, like, first of all, that like a lot of, one of the drivers of the infection and its spread is human behavior. And I think that has, a lot to take away in terms of the role that technology or a contact tracing app would play in that regard. And secondly, that these mechanisms are sort of short-term mechanisms, if you like, things that can be addressed by short-term policy. So if we're saying it's not due to underlying or pre-existing structural inequities, then policy can do something now. It's not just that we're talking about long-term changes in health indicators or other socioeconomic factors. And so the authors highlight a few things that could be introduced, sort of short-term policy measures that could be taken to address these two mechanisms. And I think they seem straightforward in retrospect, but more governments, more countries should be thinking about this more targeted approach. So they include, for example, maximum occupancy rates in the places of interest that have the highest risk, so that they're typically more dense and people spend more time in them. And they find a very interesting non-linear relationship between the maximum kind of occupancy rate and the reduction in risk without sort of sharply reducing mobility. Other examples that they give, other suggestions that they make, for example, are to reduce density, so to introduce food distribution centers in neighborhoods where people are all congregating on a single grocery store or a single restaurant or other food and beverage outlet, to sort of spread that concentration. And then, in terms of reducing mobility further, obviously the reason that some of these groups are unable to reduce their mobility as much is because the work they do cannot be done from home, which is one of the big kind of inequalities of this crisis that's been kind of thrown into fresh relief. If people can't leave their home, you need to incentivize them to be able to stay at home or make it possible for them to stay at home. And so that means income substitution and providing income support or other support. And where it really can't be done, then to make working in these essential venues more feasible through more protective equipment and through better distancing measures.
Thank you so much. And one of the, I guess, big questions coming out of that is what is the role of digital technology, if anything, in trying to sort of facilitate some of those interventions? So, Michael, back to you. We've talked a lot about Google and Apple already and similar platforms, and we focus on them due to their central role, in particular in developing the Gaian protocol. But in your experience, what other tech partnerships have caught your attention over the past half year or so, and what are some of the concerns that that these raise in your eyes? What should we be worried about in terms of the involvement of other players within the tech sector in sort of public health and other important functions of government?
Yeah, that's a great point as well. And I think so that some of these actors come back again in different functions. So you also saw at the beginning Google using mobility data and publishing mobility data. And mobility data is of course an interesting example of really scavenging from many different sources at once. Governments have been approached by companies in the ad tech space who have buried SDKs inside apps in order to sell mobility data for the purpose of COVID-19 tracking from as far as I've been aware for several months now. I've been hearing this as well. We also have the interesting question that I think has emerged, particularly in the UK, of who do you turn to when you need to scale up fast and create new digital infrastructures? And this has been perhaps ideologically, the last thing that certain governments with certain ideological perspectives want to do is to invest in public capacity, and instead they are scaling up the using private capacity, and you see this is really very haphazard. The way in which these systems are sort of piped together. We see the contact tracing system in the UK. Of course, as many people go, oh, it's all run by Serco, it's all run by this, it's all run by that. In reality, it's run by many different organizations who have plugged platforms into each other in a very haphazard way, with no real problem framing or forethought from the organizations that are managing it. And I think that's why it's touched a nerve, because it's not that in the UK, NHS Test and Trace is not in charge nominally of this system. It's that they aren't in charge in practice, and people can see that quite clearly. That's why people get very annoyed at companies like Serco, because they are, the public health space does not have the capacity to stay in charge of problem framing when technologies are involved and when data sets need to be linked and so on. So I think that's what we've really seen there. And of course, companies make great use of that. We've seen Palantir trying to be a data linkage organization and getting their foot in that door and for future public infrastructures. So I think these are the kind of ones that we've really had highlighted, that the problem framing capacity is no longer in the public sector for technology, and how do we get that back? That's a really tricky question, but it's also a difficult one to study. And in a crisis, it's unclear where public framing capacity should be sitting, and how should it be ready? Where do we draw upon it from? Because you're always going to be drawing, if it's going to be sitting with individuals who are just, they're not going to be sort of sitting down their chairs rocking away until a crisis. They're going to be in a field like taxation. They're going to be like food safety. They're going to be in some other field where you say, okay, it's that frame of reference, that type of thinking we need, like logistics, like Seda talks about a lot in this space. Where do you draw this expertise from at times of crisis? Because it shapes your response. And I think we need to think more about that when we think about technology. We don't think about that. And very lastly on that, when we look at the public, the AI procurement guidelines that have been ghostwritten by the WEF and the Office for AI in the UK, these are an unmitigated disaster. When the draft version came out, the second version, it's ridiculous how they've ended up in a public document. But the first document effectively says, in their principles, says just outsource your problem. Just make it like a challenge. So like, how do you, we need to reduce poverty, put it out to tender. And that broad idea, that there is a push to outsource that problem framing. So we need to think less so often about the technology and where that's coming from, as much as where's the problem framing coming from, because the technology follows, because people who frame the problem to work with the technologies they sell.
That's really great, Michael, and something to bear in mind. Like this question of who frames the problem and who's allowed to frame the problem, in fact, who's given the license and authority to do so. Excellent perspective. So Seda, over to you again. It's been suggested that the decisions we take regarding the use of digital technology during the pandemic will have lasting, if not sort of profound effects on society, particularly our institutions. What concerns you most in this regard? In the sense of decisions that we take now having long-term impacts that perhaps we don't necessarily appreciate in the middle of a crisis.
Right. I mean, as somebody who, I think we've known each other that long, Aaron, but like as somebody who belongs to communities who have been permanently harmed by the measures taken with 9/11 and the war on terror, I really do not see this as a transient crisis moment. with decisions that are being made that can be undone afterwards, because I think this is the afterwards in a sense. So yeah, so I mean, starting from that, and I think if I go back to, I love the way like Michael and I are dancing like on this two sides of the same problem. If I look at the things he's talking about with, you know, outsourcing to these companies, where these companies are coming from are from the perspective of services, and by that I mean software as a service, right? Like we no longer have institutions that run their own packaged software or have tailored software, but they just plug in services. The plan for these companies has always been, you know, described also in like management talk as unbundling organizations, disrupting sectors, and then rebuilding institutional roles in the image of services, right? And so what this basically translates to is hollowing out institutions, but not the neoliberal of like, we just privatize and that's what is done. Like you keep the institution intact, but you hollow it out. So it has to still do the job of connecting to a population or citizens, or, you know, in the case of education, to students and whoever the stakeholders are. So what happened with COVID is that this process that had been pushed and is being pushed by industry just got fast forwarded. And if before in educational institutions or public administration, there was resistance to this kind of move, it was no longer possible with COVID-19 and us basically splitting society in those who can work from home and those who will deliver services to those who work from home or who get sick, right? Like, and in fact, if you look at the computational infrastructures, they do not automate humans away. They just remove expert, expensive humans and then replace them with like little labeling humans or task workers and gig workers that then we're not supposed to talk about anymore. So they did that. COVID-19 created that society of those who depend on technologies to do work and to live, and those who work to uplift or uphold those technologies. And so institutions went along. So what does this mean for an institution, right? Like, so let's look at the contact tracing app, right? Like we think about the app as a kind of standalone thing. And again, Michael was kind of pointing at, okay, there were a few companies, there were these call centers, the apps brought to us call centers, right? And it's not a coincidence that they brought to us a bunch of call centers, because the whole concept of flipping the stack on the health infrastructure, where, you know, you usually your idea of a public service is if you're sick, you go and see a nurse or a doctor or, you know, somebody who can help you, and they call that the stack. So the stack has humans on top and then there are computers in the middle somewhere. And flipping the stack is that you enter the health system through your app. And then if your app says, maybe you should talk to a call center, you talk to a call center. If you spoke with a call center and they can't help you, then eventually you see a health worker, right? And in fact, we saw this with COVID-19. The app makes you call a call center, which has employed, you know, accordingly to a report in The Guardian that Michael shared, a bunch of 18 to 20 years olds who are not ready to answer these questions and who are just like burning out under these work conditions, who have then been leveled up to inform people about COVID-19, and then to find out, you know, people have lost loved ones and now they have to deal on the phone with these people, and just a huge mess. And it's not a mess of the crisis. This is the plan. This is how you optimize processes. And so it's not just about outsourcing, but it's also this model that is being brought. And I'm really worried that I'm really hopeful that institutions will be like, we don't want this. Like, fast forward, you allow me to see this now? So no, but I'm really worried that they're going to stay. So those are the two things, I think. Yeah.
Great, thank you, Seda. I'm going to put one question to Nikita, and then we'll turn to some of the questions coming in from the audience. Nikita, I think it was last week as well, perhaps a couple of weeks ago, I don't recall exactly. There were some reports also emanating from the UK about people having been denied home testing kits because they failed a credit check, which I think was quite shocking for most observers. But I also think it's arguably a very sort of fairly unique problem to the UK for different reasons. But could you help us understand like how this is happening, how people are being denied access to test because of a credit check or a failed credit check? How prevalent a problem it is in the UK, and potentially what can be done to prevent this from happening again?
Yeah, absolutely. So actually, this happened to me. But back in May. I believe that the NHS is using TransUnion for identity verification of someone who's applying for a test. So TransUnion is one of the three big credit reference agencies, credit reporting agencies, and it's not just used for credit checking, it's also used for identity verification. It's also used for those things in non-credit contexts like employment and rental leasing, for example. But when I did it back in May, failing the online test simply, which I think is because I haven't updated my electoral registration, it only means that you then have to call somebody. At that time, only meant that you had to call someone and you go through the identity verification over the phone, but you can still get a test at home. But now I think what's happening is that due to resource constraints or whatever it is, if you fail the online test, you then have to go in person, right? So you can't do an at-home test. And this is much more significant because, of course, there are large kind of questions of fairness when it comes to the kinds of communities who are more likely to fail this test for a variety of reasons and who are more likely to experience high costs of going to attend in person, whether due to reduced mobility or because of lack of access to a car or whatever it is. So it is problematic. I think it just speaks to a larger problem that we have when it comes to sort of identity verification, in a digital age. The existing infrastructure sort of, they hark from a very, an olden age where there were very defined and fixed number of data points that are used to identify a person, and a lot of identity verification would be sort of face-to-face, like you see somebody, you can confirm that this is that person. But they haven't really been upgraded for the digital age. So if they're going to use TransUnion and they're going to rely on, say, like electoral registration and just a few data points, and if you fail those, that means you can't be verified. It's a very, very narrow window of a person's identity, and there should be more ways of verifying identity digitally. For example, could a person not upload, a picture, or there are many techniques. Of course, you then enter into kind of the territory of, how much data should there be access to, and is this sort of going to be privacy infringing, and so on. But there is a balance, and I think there are ways of developing digital identity solutions that are sort of privacy supporting. But yeah, I think this problem, it really speaks to the sort of broader problem of the way in which we do credit assessments and identity verification. There is innovation taking place with more alternative data, machine learning techniques being used, but they're still nascent for for all intents and purposes.
Thank you. Yeah, it seems like the UK has been trying to sort out its identity infrastructure for some time now, and I think this is just another example of where things are somewhat broken. But I appreciate your experiences, and in particular the sort of personal reflection on how this having happened to you. So there's some questions in the Q&A box, which I'd like to pose to the panel now. And the first one is for the more legally minded folks on the panel. So it comes from Peter Wells. He asks, there's a risk that we think of the public sector as one thing, as a monolith, when in reality, each government's many different organizations, national, local, domain specific. So for example, health or transport. Here's the question: how do we build a legislative environment that gives more control over technology infrastructures to the appropriate organizations? So Michael, I think you started to touch on this in one of your previous responses. Perhaps you could provide some perspectives on how best to sort of rethink legislation to allow for better control by public sector organizations over infrastructure.
Thanks. So I think personally, I'm not sure that my thoughts on this are fully developed yet. It's hard to build a normative idea of what to do, but one challenge we have at the moment is that as predicted by many scholars for decades, the internet becomes locked down as people's devices get effectively controlled. You're not allowed to use them in a free way like you can use a PC. You can't install anything you want on it. You can't install any kind of functionality you like. And so the problem stems in a way from this. That's why these gatekeepers exist. And they also exist in trying to do this because they are trying to control security and avoid malware. But that's one dimension of it, but there are many other dimensions to the reasons for that control. So I think if we were to collaborate internationally and create a kind of new legislative framework around the world that demanded and provided rights for openness on technological on platforms and devices but mostly devices, I think, that people owned. That gives an opening for governments to at least have the possibility for citizens with legitimate buy-in to say, yes, I will participate in the system that you are proposing. Now that causes a wide variety of other problems for governance, so it needs to be supplemented by significant data and information regulations, and also digitally minded human rights. Human rights developed with digital issues in mind, and further refined from the ones we have today through, for example, case law and through further judicial developments as one stream. But I think we start with allowing those platforms to be open and putting. And if it comes with new security risks, we come up with institutions to deal with those risks and to manage them when these do work at scale. And so I would turn the question a little bit away then from what Peter said of how do you kind of let local governments come in and choose what they want in a particular platform and have a say and control. In the end, a platform can't be an operating system. We can't have an operating system, one per little tiny administrative unit, especially when we live in a multi-level governance world. I think we have to develop operating systems that run on certain principles that we think are democratically valid, and that allow governments and citizens to interact with each other in digital environments mediated by digital technologies in a legitimate way. But ensuring that legitimacy is in the next step, because we know that states have a lot of coercive power where they can use other means to, say, force people to install devices or use sensors in certain ways. So that pushes that concern forwards into that area. But I think that's the area where we have to govern it and have to struggle through, and we shouldn't be governing it using kind of platform goodwill of we will or will not allow individuals to run software themselves on their own devices.
Thank you. Did anyone else want to pick up on this, Sarah or Nikita?
I don't know if we have so many questions.
We do, yeah. So I
would love to take it, like I think maybe.
So the next one is, it's been upvoted the most, from Maximilian Fashan. If data is the product of a plug and play of many private company services, how much belief should we put in the data we aspire to analyze for insight? So a really good question here about, the sort of the extent to which the data that's generated from these services provides sort of a truth, a sort of a reality that we should sort of believe in. Anyone?
I thought maybe Nikita might take it, but Nikita, do you want to say something? Because I mean, you just kind of spoke to it a little bit, but.
No, go ahead.
Okay, all right. Well, I'm going to look at it a little bit from the perspective of machine learning, and then I'll see if I can connect it to contact tracing apps again. The thing is that, so one of the kind of provocative statements I've decided to land on recently is that there's no machine learning without this infrastructure, and without the kind of ways in which the computational infrastructures that we have produced ways to optimize how you implement, for example, anything that is based on data analytics. Which is that most developers will use existing APIs, but now they'll use existing data sets like Palantir loves to do. And they won't even train their own models, because that's also expensive. So they'll take a trained model and then just contextualize it in techniques that doesn't require the whole model to be trained. So this means that accountability has been like completely spread out over both data quality and how the models come to being, and what kind of, quality they have for the context that they were never meant for, maybe, right? Like, because you try to train models in a way that can be used by multiple service developers rather than one, because that's how you optimize, right? And so I think where we saw like some of this in the case of contact tracing is that we use Bluetooth and attenuation to measure the distance, but in fact, it's not a reliable API. It's not the API that's a problem, but the interface is not really reliable. Bluetooth was made originally to remove cables so that you can take a message from A to B, right? Like, it was never meant to see how close you are to somebody. So there's a lot of noise. And what we had was a bunch of governments and also, scientists, or I don't know, claiming the scientific hat data analysts, who said, we should have access to this data. This was in the centralized designs. We should have access to this data so that we can do scientific measurements. And we're like, look, we're barely able to say, those signals are probably proximity and those signals are probably not, right? Like this is not unreliable scientific data, and that you keep on saying you want to use this for science is very, very worrying. And so I think here I want to cite Virginia Dignam, who said one of the technologies that got catapulted during the pandemic is these kind of quantitative models for policy management. And I think that we should, and there's a really beautiful quote in the book. So let me do that. It's from Karen Young, who is quoting the director of the Nuffield Council of Bioethics. And she says, or this person says, notwithstanding the correctly much vaunted science held as justifying not allowing loved ones the chance to accompany in the dying process, I have been concerned at who has been formulating this kind of rule, using what process and precisely what rights, interests, risks, and benefits are being drawn into the analysis. Do we have a failure of moral proportionality? And I think there were so many decisions made and still are being made today based on some quantitative model, on some model of population, which could have been developed for a completely different thing that is being applied by policymakers to determine that we're going to be a 1.5 meter society and what have you. I think we have to ask a lot of questions, both given the data and model pipelines that are being used and also the unreliability of the data that we have and the kind of normalization of really terrible normative ideas by policymakers.
That was great, Seda. Thank you so much. And I appreciate you having the book at hand as well. That's very helpful. So another question, which is actually quite near and dear to my heart, it's about COVID-19 digital certificates. Examples here being vHealth passports and the Yoti solution in the UK at least. Question is, how do you go about analyzing the trade-offs and benefits of allowing travel to restart and helping the airline industry, possibly preventing fraudulent paper certificates, controlling a public health crisis, et cetera, through the use of these immunity sort of passports or certificates, assuming, one day we societies reopen and we're allowed to move around with proof of vaccination or immunity. Does anyone want to tackle this? Well, so where should we begin in trying to analyze trade-offs and benefits to such a system?
Yeah, I can give it a go. And I think the first question is like, what is being certified, right? Like, so, is it the fact that somebody's been vaccinated? Should that be the threshold for, a bit access to travel, say? Or is it that they've developed antibodies up to what threshold? But not everybody fights COVID through antibodies. So do they, do you just assume that they have like memory cells? Like, so I think that calibrating this system, whatever it is, and I know there are a bunch of prototypes out there, is important, and it needs to be designed responsibly. And then sort of once you have something in place and assuming that kind of we've thought through the right metrics, and of course you have questions around like the fairness implications, right? So where essentially you're going to be creating, two types of citizens, those who can and cannot based on whether they've checked that box, whether it's immunity through vaccination or through naturally developing antibodies or otherwise. And that could mean obviously excluding large swathes of the population from access to certain services, whether that's travel or education and so on. And if that is going to be the way to sort of reduce infection spread, I'm not saying that it is, then we would need to be thinking very carefully about how you compensate those who are restricted, right? So I think right now, and this kind of links back to the conversation we were having earlier, I think, if we were going to reduce mobility of certain kinds of people, because mobility is an important mechanism in the spread of the infection, then you need to do something about like the people who you are restricting. So in places like, I think New York, for example, has a very micro-targeted sort of approach at the moment where different neighborhoods are at different levels of restriction, which is good in principle, but I would like to see that it's also it's complemented by benefits for those who are being held home or being forced to stay at home. In the same way, you would need to compensate those who are restricted from moving based on their health certification.
Thank you, Nikita. So the questions are piling up now. I'm going to jump into One, which I think will be best answered by the DP3T representatives on the panel. It says, what are some of the governance best practices you've seen in COVID-19 contact tracing apps? Coupled with that, what are the path dependencies that you foresee we've created in the use of these applications?
I could quickly say a couple of things about that. One thing that's been really interesting is when we started DP3T, we were very keen to publish everything openly, to keep publishing and engaging, and it was almost a bit of a lightning rod for a lot of broader debate around governance and policy and societal concerns around technological intervention, because a lot of people weren't publishing or being quite secretive in the way they were governing it. But going forward, we saw a lot of governments, even ones who had never done so before, being forced and pressured into making their code and documentation and processes somewhat open in relation to the development of their own systems. And that was just an interesting echo of a governance practice, which I think was set at the beginning. And it showed, I think, some of the academic responsibility in setting a tone sometimes, at least in this point. But I'm not saying it's a panacea, it's just an interesting kind of side point in a way here. Another practice which we've only seen in some countries is active the complementing of the code-based governance with the law-based regulation, if you want to kind of use those kind of problematic frames. And this is the idea that there are limits to what you can do with the code, and you need to actually put law in. In particular, we've seen countries like Switzerland, but also Belgium and some other countries put in active implementing laws which try to limit, can you be made to produce this? Can you be made to install this? Under what conditions? Maybe never. Australia was one of the first countries to do this as well. And there was a draft bill that Lillian Edwards led in the UK on this topic too. But I think that was a good practice to realize the limits of technology and governance. But it required, in a way, what we saw is different groups were not talking to each other. Within the UK, the app team doesn't even talk properly to the other public health team. We've seen the QR code scanning system in the UK is wholly performative. Millions have been printed, none have been activated. None of it's all performative. Same as the potential for immunity certificates to be completely performative security theatre, which has a longer view as infrastructure that stays and is repurposed really for something else. That's my general concern. And I think that because there was that lack of talking that resulted in performative technologies, many of the organizations pushing apps were never talking to legislative bodies about how to make them have a landing in a legal framework that worked. So I think that's a characteristic, and it's it was a good practice, but it's definitely a practice.
Thank you, Michael. So a question just came up on the in the Q&A box, which is fascinating. I wasn't aware of this, so I'm going to throw it to the panelists. From Angela, it says, it was announced yesterday that Amazon's launched an online pharmacy made possible through its 2018 purchase of PillPack Incorporated. U.S. consumers simply have to provide basic health information and their social security number to get access. So here's the question. Do the panelists see a future in which Amazon could become a vector for distributing COVID-19 vaccines to people? And if that were to happen, what do the panelists think the impact would be on, sorry, the question just jumped. Here we go. What would be the impact on tech governance? Would it exacerbate the problem that exists today? Hope that question makes sense, makes perfect sense. And thank you for the excellent question, Angela. So how do we feel about Amazon becoming the platform of choice for vaccine distribution, at least in the United States and potentially like more globally? Anyone?
They'd probably be the candidate for Canada as well, because they did already strike a deal with Trudeau, which I think Bianca Wiley writes about in the book. I feel like I'm the advertiser for the book today. Read the book, read the book. Yeah. Don't shake phones, shake the book, right? Yeah. All right. Well, I think indeed this is the kind of infrastructural, logistical expansion that we're seeing with a company like Amazon, which is willing to forego high profits in the pursuit of expanding their infrastructure. And I think, you can say, oh, and I think a lot of policymakers say, the problem is that we have one company, right? Like it's a single company that has immense amounts of power and valuation, at least not maybe profits. But I think the problem is that, if we thought it was kind of, I saw some of the questions going in that direction too. When government said we need something that, you know, maybe increases the efficiency of contact tracing, the only place they could go to was Google and Apple, right? Now, let's imagine if all of our logistics for like emergency logistics, the only place we could go was Amazon, right? And if we think there was a problem with Google and Apple coming to all sorts of governments and starting to tell them what the design should look like, for whatever reason, you know, it might be privacy preserving, they might have, you know, shown themselves as the good arbiters between citizens and, you know, surveillance loving governments, while, you know, offering those same governments, you know, a way to do population management using their own infrastructure. We saw like that it actually had a damaging effect on governance structures, right? Like it made it much more difficult for civil society to have a say in, for example, when you want to sunset this thing, you can remove the app, but the functionality is still in the operating system of Apple, right? Like you just like undid the power of many actors that we depend on to have democratic governance. I think Amazon taking over logistical infrastructures like that would have a much bigger impact. And I would not want to see that day happen. I fear I might.
I just wanted to kind of chip in actually.
Please, Nikita.
Yeah, continuing my own personal narrative. So Amazon actually delivered a lot of the home COVID testing kits, or fulfill the delivery. So they're kind of part of this health delivery infrastructure already, and obviously part of the general infrastructure. Although I think it might be a bit, that's a kind of like business to consumer, whereas in the context of vaccine, I don't know that they would be able to play such a big role, because the like the logistics for that are a lot more complicated by the fact that they need to be administered by a professional, and there's a very complicated storage temperature requirement and all these things. So, you know, maybe there's some hope that, you know, they aren't going to be all consuming, because delivery of vaccines requires a bit more sort of sophistication and technical requirements.
Very quickly, just on the Amazon point, sometimes I think people forget that, of course, people have been ordering a lot of things to their homes from Amazon during this time, and that Amazon have generally been losing money on all of these transactions because they're small items. So the whole thing, Amazon have got this crazy business where they've cross-subsidized a critical infrastructure of home deliveries during a pandemic with cloud. Like it's not people be, oh, I don't want to use Amazon for that, you know, deliver that small brush or something because I don't want to give them more money. Every time you do that, you are losing them money. But you know, it's just that we have taken this mad dot-com bubble style cross-subsidy nonsense, and it is also at the heart of now, as Seda describes, this like reliance on turn to this to get something done in the public sector. And that's not just fragile. That is really installing a different kind of virus at the heart of public utilities. You're really laying a bomb underneath the whole of the public sector and just saying, well, hope the financial models of these companies don't ever change, because then we're screwed.
Absolutely. So on that point, there's probably our final question, depending on the response time, from another anonymous attendee. Here she says, great points about the tension in governments borrowing, repurposing private digital infrastructures. What alternative approaches should be taken by governments, say, for example, to build a predictive health data infrastructure for seasonal illness like flus or future pandemics? How are such technologies developed? How do they scale? Are they more trustworthy than private infrastructure? So, you know, to this point about our increased dependence on private companies and their infrastructures to deliver services, goods, vaccines, even at scale, what are the alternatives? And are they more trustworthy? So I'll leave that sort of to you all to respond.
We are shy.
It's also a really hard question to answer.
Actually, yeah. I mean, I think you know, when the last 6 to 8 months, I think, you know, a lot of this work that I'm doing comes with a collaboration with Martin Poon, and we both agree that we haven't yet really sized the dimensions of the problem to be able to say this would be an alternative. And so I think my invitation to all of you is to say, let's look at our problems a bit more closely before running into, if we just had the right data, if the algorithm was fair, then we would be done, and not look at this computational infrastructure and the power that it has now shown to us very clearly, thanks to COVID-19. So I see that as a bit of a silver lining as well. But I need to, you put the question away, and yeah, the alternative. So I think it's not an alternative, but I think what we need to do immensely fast is capacity building in institutions so that they understand what this proposition is, including in government institutions, right? Like, but also corporations. Like, corporations are subject to the same service-based unbundling and hollowing out of institutions as public institutions. And I know in some way they're scared, and they would understand this conversation just as well as government institutions. So I think capacity building in institutions, the kind of things that Michael was referring to, is really, really important. And I think what a lot of the health institutions, they've been under like immense austerity pressure for the last decades, and they have not been really serving the people that we're seeing are really underserved right now with COVID-19. So really making a point out of being institutions that are not as profitable to these infrastructures because they're already like marginalized, but you know, they're also not, yeah, I can go totally into deep depth in that. Yeah, we need to think the strategies. I don't really directly have one, but I think about the trustworthiness, like for me, you know, the DP3T thing was a very interesting experience in trying to do a solution that was damage control. Like, we didn't want a bunch of apps that would collect all sorts of data, and we wanted to show that you could collect less data and do contact tracing if you so wish, right? Like, we didn't think that apps and Google and Apple should play a role in here. You know, but I think one of the problems that is not visible, and it's a hypothetical, but I will say it here anyways. In some moment, as we were working on DP3T, some governments came and asked us if we could change the way in which the notifications were sent, if we could reduce them when the governments ran out of hospital capacity or ICU capacity, right? Like, so you would basically stop notifying people that they were at risk because the government ran out of health resources. Now you can say, isn't that great? You can optimize your resources, the notifications, and make sure that not many people go to hospitals you know, in times when nobody can take care of them. But you can also turn it around. Let's say I'm a government that wants to continue with austerity measures and want to conceal that I have done so. I can stop giving people notifications and give them an image that everything is under control. And so I think, you know, that kind of governance model should never be trusted. And I don't care if it's a corporation or a data analyst working in the public interest. We have to be very careful about building those kind of logics into our public institutions.
Thank you, Seda. Unfortunately, we've run out of time. So I want to thank everyone for joining. Thank our panelists, of course, as well. Seda, Michael, Nikita, for sharing your views with us today and for engaging with us all on these critical issues. Thanks as well to OII for hosting us. I'll hand it over to the organizing team. This webinar will be posted online for future reference for those who are interested. Thanks again for joining, and we appreciate your time.
You've forgotten the one important thing, Aaron, which is the book has invisible ink. If you put your hand on and it warms up, the cover disappears.
Yes, of course. Check out the book. It's got a fancy cover. I'm remiss in not having a copy with me today, but thankfully my panelists have done the job.
Thank you so much for a fascinating insight today. Thank you all for attending. You will receive a follow-up email in due course. Next week, the OII's Dr. Jonathan Bright is hosting Professor Sinan Aral on Wednesday, the 25th of November. Please visit the events page on the OII website to sign up. Thank you again, and goodbye.